I want to talk to you a little bit about digestion. So one of the things that happened to me when I transitioned was I went from, plant-based poop world, poop king, 25 times a day, just nonstop, to doing these little rabbit pellets once a day and feeling like there's nothing in my stomach. I go from plants making me feel bloated and full constantly to meat. I eat it, nothing happens. I poop little pellets. Everyone's tripping out and saying, where's all the poop? Please explain to people what is going on so people can understand a little bit deeper of what's really happening with the assimilation and digestion process.
Yeah. So, human beings, and it's clear again, assuming you believe in a theory of evolution, many people, and there's people out there that don't, but I mean, if we assume that humans evolved from a common primate ancestor to things like chimps and gorillas, and we diverged 7 to 10 million years ago, depending on which anthropology record you read, and then during that process, particularly starting in about 3 or 4 million years ago, we started to eat more meat, and so our anatomy started to change. We sort of went away from a large hindgut, which a lot of these gorillas and chimps have. They have a fairly significant hindgut fermentation capacity, so that means they can take fiber and plant material in their colon, which is much, much bigger in the chimpanzee or the gorilla, and they have a pretty good capacity to turn that material into short-chain fatty acids. So they're even though they're eating a high-fiber plant-based diet, they're still absorbing a high-fat diet. So, but it's coming from short-chain fatty acids, things like butyrate and other fermentation products, propionate and things like that. So, as we lost some of that capacity, as our colon shrank, we lost some of that fermentative capacity. And so now if we do comparative anatomy between other animals, our fermentative capacity based on the amount of GI tract we have is about 17%, which is about the same as a dog or a cat. Dogs and cats have about 15, 16, 17, 18% fermentation capacity when we talk about the total amount of, intestinal tract, digestive tract we have. So we've lost some of that capacity. And so we became a very acid dependent, this strong, powerful hydrochloric acid we have in our stomach. Remember, our hydrochloric acid, it tends to be about 1.5. Sometimes I've seen studies down as low as 1.1. That's on par with scavenger animals like hyenas, vultures, and other animals that probably started out scavenging, which most likely humans did as well. We probably started out scavenging until we learned how to hunt. So we've got this tremendously acid stomach, and we've got this incredibly relatively long small intestine relative to other primates. And so that is perfectly designed to absorb protein and fat. And that's, generally from what we get from meat. But when we look at ileostomy patients, so there are patients out there that have lost their colon for various reasons, whether it's from colon cancer or they've had Crohn's disease or ulcerative colitis and they had to lose their colon. And so now they just have a little bag, a little pouch. So we can see what comes out the small intestine, and there's studies that have looked at that, and there's plenty of ileostomy patients that'll confirm that. I've talked to many of them. They'll say, when I eat meat, the only thing that comes out of my out of my stoma into my bag is just a tiny, tiny, tiny bit amount, a little bit of liquid. When I eat fiber, nothing gets digested. It all goes into my colon, so it has to be digested by bacteria in my colon, and that's where you get the bloating. That's where you get the gas. And you think about. And I think this is an interesting point. Think about breathing. Does it hurt you to breathe? And you'd say no. And if it hurts you, you'd say, wait, there's something wrong. I need to go see the doctor. When your heart beats, does it hurt you for your heart to beat? And you say, no, it doesn't hurt. And when you walk around, do your joints hurt? And most people, the answer should be no. If not, there's something wrong. But we accept the fact that our digestion can hurt. We're like, well, bloating, it's just bloating, it's just gas, it's just normal. I would posit that humans are not designed to hurt. I mean, a normally functioning system should not hurt us. And so, we shouldn't accept bloating and gas and discomfort as normal. That means there's something wrong going on. And I would argue it's a diet. And so, but to your point about, large bowel movements versus small bowel movements, I mean, it's as simple as the fact as you are now absorbing all of that nutrition. It's not going to waste. You're not flushing it down the toilet. So all that organic fruit you spent at Whole Foods and you spent high dollar for, you ate, half of it ended up in the toilet. 40% of it ended up in the landfill, and then half of it ended up in the toilet. And so you're being very wasteful. You're not taking in the calories. That's why a lot of vegans can lose weight, because a lot of their nutrition just ends up in the toilet. On a meat-based diet, it's extremely different. All of that food, almost all of it, ends up where it's supposed to go, which is to your tissues. It gets in your bloodstream, and then you get the amino acids and the fats and the fat-soluble vitamins and minerals. All of that gets into where it needs to go, and therefore you just don't have as much waste. And so now the waste products are what it's supposed to be. It's some bacteria, and it's a little bit of the sloughed off cells lining our digestive tract, and that's what the stool becomes. And so it's a lot smaller. And so people, when they initially transition to diet, they're like, oh my God, I didn't have a bowel movement today. Some people, it might take them 3, 4, 5 days, even a week before they have their first bowel movement, because their body is just like, I'm not wasting anything anymore. And so nothing really is built up. And so it takes, several days. And, there's some people that have transition issues. There's some people have diarrhea. Some people have some people have some constipation, but in general, it's just, you're not wasting food like you used to. It's not, again, you're eating a high quality nutrition that your body needs and is utilizing as much as it can.